Okay, suffix esthesia, meaning feeling or sensation. This is a sort of random place to place this slide, but it applies to so many different topics. We've gone ahead and placed it here. Should probably move the slide up closer to where we talk about circumcision, because anesthesia is definitely something we're going to do in circumcision. Anesthesia, of course, meaning without sensation or feeling. So we take the suffix esthesia and put "an" in front of it, and esthesia meaning feeling, sensation, put the "an" negates it. So now we have anesthesia. Two types depicted here. We have general anesthesia, you see on the left. So that's going into the OR, and we have an anesthesiologist applying the initial anesthesia to put you out. And then, of course, they have IVs that they give you fluids and other sorts of medications, and they continue giving you anesthesia via the IV route during the surgery. And then there's the localized version. We've already covered these. So we have, systemic, which would be more the general anesthesia, and localized. And the localized version over here, this is what we do during circumcision or during a TURP, for instance, that we just talked about. You're going to put that anesthesia in locally. It's going to numb that area, but it's not going to affect anything beyond that area. So there's our term anesthesia. As I said, it's random that we put it here, but there it is, and you have the word now. So, and I'm sure you're familiar with it. You've probably heard it before. Now, we talked about benign prostatic hyperplasia, which is a benign pathology. So it is enlargement of that organ due to hypertrophy. So it keeps producing cells and closes off the urethra, vas deferens, and causes some problems there. It is not the same as prostate cancer. Prostate cancer is a form of cancer. There's usually two forms of it. There's a form that one gets after the age of 40 or 50 that's very slow developing. My dad was personally, it's a personal experience, was diagnosed in his late 50s with prostate cancer, and the doctor told him that the cancer would outlive him. And my dad died at age 93 and did not die of prostate cancer. It was very slow developing. He had a few TURPs along the way, and you know what a TURP is now. But it wasn't highly significant to him. There's another form that I'll cover in just a moment. Whichever form you have, we have something called a prostate-specific antigen. Pardon my stuttering there. PSA, this is a blood test to screen for prostate cancer. That is not exactly true. There are no blood tests for cancer. We sometimes will see them because there's an extremely high elevated white blood cell count that would be even higher than infection. And that might cause a doctor to look for prostate cancer or a different form of cancer. PSAs do not diagnose cancer. They're just another tool. So if there's a high level of prostate-specific antigen in the blood, it could indicate something going on with the prostate. It could also indicate very simple things like sexual relations were happened within 72 hours of the blood test. So many doctors, when they order this for men, they don't say no sexual relations for 72 hours before you have your blood drawn, because that will elevate the level of PSA in the blood. So I've seen more than once that a male's gone in, got the blood test, the PSA comes back elevated, they panic, think I have cancer, and they repeat the blood test following the protocol, and no cancer found. That being said, PSAs are run part of men's health after age 40, and they do monitor them, and if they get to a certain level and become concerning, they start considering prostate cancer being there. And of course, if they hit a certain level, then PSAs are very efficient, but it has to be a very high number before it gets more definitive. Either way, it's a blood test you should pay attention to. Maybe you've seen celebrities talk about it and say it's the blood test that tells you about prostate cancer. That's not exactly true, but it is an indicator and not to be ignored. And of course, the topic I've just been talking about, prostate cancer itself. According to the American Cancer Society, it's the second most common cause of cancer deaths in men, beneath lung cancer, of course. About 250,000 men are diagnosed annually, and approximately 27,000 die from the disease. Incident increases after age 50. It's found most often in African American males. Now, that was a statistic that was relevant as of a couple years ago. I don't know if that's currently accurate. My guess is it probably is, but I wouldn't stand on that as hard, fast information. The biggest indicator are men with a family history of prostate cancer. So, guys, if your dad had prostate cancer, your chances of getting it are good. Generally speaking, as I said, most occur after the age of 50 and are very, very slow in progression, and sometimes will not require any treatment at all. There is another form, though, of prostate cancer, and it happens in men under the age of 50 as much as early as in maybe the late 20s, early 30s. This is generally a very, very aggressive form of prostate cancer, and the majority of those 27,000 deaths you see listed here, which is about, what, 10% of the people who get prostate cancer. So around 10-15% of those get the aggressive type. That can also happen after the age of 50, but more likely under 50. And those have a very different type of outcome. And they're not the type that, like my father had, where they would say, don't worry about this, we're not going to do anything. The more aggressive form of prostate cancer is the majority of those deaths. And of course, it is something they want to address right away. Because if it's a young person, we should stop at no possibilities to try to stop the disease state, within reason, of course. Another pathology associated with the male, gynecomastia. This is an abnormal enlargement of male breasts, so they can take on sort of a female appearance. Gyneco is going to be the word we're going to open our lecture with in the second half of chapter 8, and it means woman or female. So andro is male, gyneco is female. Mastia is a suffix that means breasts. This is an actual patient depiction here, both left and right. So left is pre-op, right is post-op. This is considered cosmetic surgery, so insurance won't pay for it. The patient pays for it themselves. If it's an important operation for the patient and they're willing to fork out the money that would be required to do it, then they can be performed by a surgeon, and it reduces the breast size. And if that's significant for the patient, once again, then it's something that can be pursued. And here's another random one. You've heard me use these terms already: unilateral, bilateral. So unilateral means pertaining to one side. That's uncommon in gynecomastia, but it can happen that one breast is larger than the other. Of course, females see this quite often, breasts being more prominent in the majority of the female population. Bilateral means pertaining to two sides. So the enlargement that we're talking about could be unilateral, could be bilateral. Either way, the takeaway here is the meaning of these words: unilateral is one side, bilateral is both sides. These are used very commonly in medicine, so they're really good terms to know. Here are your abbreviations for this week. Some of these will be on your exam. As you know, we don't focus heavily on abbreviations. I've given them to you during the lecture, so I'm not going to run them down for you now. You can take a look at them. That's everything you need to know about the male reproductive system for this week's exam. So go forward, learn the words, study, email me if you have any questions. The next lecture will be Chapter 8, Part 2, and that's going to be the female reproductive system. Thank you for your time and attention, and I hope you're all doing well.